it's CJ. Welcome to week 23 of your pregnancy. Today we're going to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what symptoms are not okay. And if you stick around, I will give you information on round ligament pain, what it feels like, and steps you can take to help alleviate that discomfort. At this point, your tiny human is now measuring about 12.1 inches or 30.6 centimeters from the top of their head to the bottom of their feet. Your baby is now about the same size as an eggplant. He or she weighs somewhere between 16 and 22 ounces or 489 and 650 grams. Your baby is now able to hear both you and your partner's voices. You should be feeling movement every single day. What were once little flutters are now turning into kicks. And if your baby were to be born this week and you have access to excellent neonatal care, they actually have a 25% chance of surviving. So, what symptoms are normal for you at this point? Number 1, your breasts may be getting bigger and you may be leaking colostrum, or you may not be leaking colostrum. Either one is absolutely fine. Number 2, you might have noticed some skin changes, specifically a line that starts at your pubic bone and goes up to your belly button. Number 3, intense food cravings. Most people crave either sweet or salty at this point in pregnancy. Number 4, visual changes. You may be having blurry vision or you may be feeling more nearsighted than normal. And while most visual changes are perfectly normal, that is something I do recommend you talk to your OB provider about. Number 5, you might be feeling more forgetful. Some people call that pregnancy brain, and it is totally normal. Number 6, your fundal height. The top of your uterus is now measuring about 3 centimeters above your belly button. If you're carrying twins, it's more like about 6 centimeters above your belly button. So, what symptoms are not okay? Cramping that won't go away. If you are having 5 or more cramps in 1 hour, empty your bladder, get off of your feet, drink a liter of water, and monitor. If those cramps do not go away or they get stronger, please contact your OB provider. It is not okay for you to have water running down your leg that isn't urine. It's not okay for you to have bright red bleeding that's enough to saturate a pad. And you should be feeling your baby move, even if it's just a little bit, every single day. And finally, let's talk about round ligament pain. It usually starts in the 2nd or 3rd trimester. However, if this is not your first baby, it can start as early as 6 weeks. You have ligaments that hold your uterus into place. As your uterus expands, those ligaments grow, and they can get pretty tender, especially if you make a sudden movement. You sneeze, you laugh, you cough, you roll over in bed, you bend over to tie your shoe. You can get a pulling sensation down deep in your pelvis, and honestly, it can take your breath away. So here are some steps that you can take that might help you alleviate that discomfort. Number 1, a pregnancy support belt. Number 2, doing stretching exercises or yoga on a daily basis. Number 3, avoid making sudden movements. And if you know you're going to sneeze or cough, splint or hold on to your tummy. Number 4, you can try taking a nice warm shower or a bath. And number 5, if all else fails, talk to your OB provider about over-the-counter medication that is safe for you to take. I do hope that this information has come in handy, and if you have any questions, that you'll leave those for me in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or even feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.